Welcome to the first session after lunch. And I know you've been doing this before, but we really feel this is important. I'm Dr. Sudesh Khalsa. I'm on the AAP Board of Directors. And we are acknowledging the Native Americans, in Canada they call it the First Nations, the people who were here before us and whose land was forcibly taken from them. And so there's many towns, cities, rivers, areas around here that carry the names both of the tribes and such. And for those of you who are new to the area, the river that runs right through the middle of Portland is the Willamette River, not the Willamette. It looks like it's a French word, but it's actually a Native American word. So we do wish to honor those who were here before and hopefully remember them and carry that spirit of living in harmony with nature forward. So I'd like to introduce Dr. Matthew Hand, an osteopathic physician. He graduated from Chicago College of Osteopathic Medicine in 1989. Did his pediatric residency and chief residency at the Maine Medical Center. And he completed his fellowship in pediatric nephrology at Children's Hospital in Boston. Subsequently developed the pediatric nephrology division at the Barbara Bush Children's Hospital at the Maine Medical Center. In 2008, he graduated from Dr. Andrew Weil's fellowship in integrative medicine at the University of Arizona and created the pediatric integrative medicine division at Maine Medical Center. In 2011, Dr. Hand was hired by New Hampshire's Hospital for Children at the Elliott Hospital to develop the pediatric nephrology division and create a children's hospital with integrative medicine as its cornerstone. He's been featured in a number of international television shows, including 2020, Discovery Channel, and most importantly, the Oprah Winfrey Show. Anything important is happening is going to show up on the Oprah Winfrey Show. So, ADD, autism, children.
Thank you. Thank you. I got to show in front of the camera, first of all. Am I good? I tend to wander. There is a reason I'm giving a talk on ADD. And I don't normally get nervous talking. I only get nervous when one person is here and she's got red hair sitting there. My friend Eileen. She always hates when I'm embarrassed. So we can swing the camera around and get a shot at her. No, I'm just kidding. So anyhow, I do kind of wander a little bit, and they told me I got to stand right here, because try not to stand in front of the screen, so I'm going to try and do that, but we'll see how this goes. And now you know everything about me, right? You heard about almost my whole life. Actually, the Oprah Winfrey Show, if you guys are interested, the reason that happened, if you ever want to know about holistic medicine, and you ever want to know about the whole person, there's one person in the world that really, really emphasized this, and it's the young lady that I was on the Oprah Winfrey Show with. She had something called mermaid syndrome. I don't know if you guys ever heard of it before or not. It's a 100% lethal lesion. No child had ever really lived with it for any period of time. They usually die in utero. They're basically fused completely, and they have no outflow. So they have no urinary outflow, they have no bladder, they have no intestines. And they develop severe pulmonary atresia in utero and die right after they're born. And this has nothing to do with ADD or autism. And I apologize, I will be all over the place, but stay with me. But anyhow, she was amazing. She lived, it just so happened that she had a little tiny hole in her back. That this little tiny piece of kidney leaked a little tiny bit of urine out, enough that it created enough amniotic fluid that she didn't have any pulmonary atresia, and she only had a mild amount, and she lived until she was 10. She died of something completely unrelated. Nobody with this kind of disease ever in the history of the world had ever lived this long with this disease. It really, it was amazing. And I always say, yes, we did kidney transplants on her, yes, we did all these things for her, but the reality is she lived this long because she never thought she was sick. She didn't think there was anything wrong with her. She used to look at me, she'd go, Matt, why you got two legs? Because they're fused. And I'd say, well, it's because God made me that way, child. She goes, great, get me out of here, I got to do a dance class. And she's like, well, she can't even stand, and she's like shaking everything she's got. She was amazing. And I said to myself at one point, if this little girl who has the single worst condition in the history of the world doesn't think she's sick, then how can the rest of us think we're sick? It's sort of crazy if you think about it for a second. And I realized that at this point, as I was going through my training and doing different things, that we really need to change medicine. And that's what you guys are doing, because that's what you guys are trying to do, is change medicine. We have to look at the health and wellness of the patients, and we need to promote health and not necessarily just treat disease. And if there's anything, almost every condition that we deal with, it's the same thing. And attention deficit, and I don't even like calling it a disease necessarily, and you'll understand why I say this, because it's not really a disease, it's how our brains are made. And it's really the perception that society has on the children that have this that really becomes the problem. Having said that, it is a disease, okay? It is a disease in that when you have somebody with bad ADD, it's really hard, and these kids really struggle, and we have to figure out what's the best way to handle them. But it really comes down to, when I look at how we manage these children, how do we best look at the whole person on this? How do we best approach this in every single aspect of what we're doing for them? And you know, I always tell the kids they actually have a superpower. Some of you guys might have, how many of you take care of kids, by the way? Oh, beautiful, great, awesome, excellent. You probably wouldn't be here if you didn't. That was sort of a ridiculous question, but I ask them sometimes. But ultimately, I always tell the kids they have a superpower. They've been given something that can make them change the world. If you look at the history of the world, I make this argument a lot, that the history of the world has been changed by attention deficit disorder. We're going to get into autism too, but there's a big overlap with a lot of this. I don't think the United States would have been found if it wasn't for attention deficit disorder. Matter of fact, they think that the founding fathers probably all had attention deficit disorder. If you look at history, think about it. The people are either more ADD or they're more OCD, right? Your brain, the society is broken into this. Your brain is either more ADD or your brain is more OCD. Now, people who have OCD don't like to say they have OCD. They say they're perfectionists and they're organized, okay? Yeah, it's funny, us with ADD go, I got ADD, I don't really care. People with OCD go, I don't have OCD, I'm just organized. I like things in a certain way, and that's okay. But that's how we're broken up, right? Well, if it's the 1400s and you're in Europe, and we'll get to the talk in a minute, and you're sitting in Europe, and you see this huge body of water, and you have OCD, are you going to go do something? You're going to say, I'm probably going to stay here and do my stuff and whatever I do. The person with ADD is going, where's the boat? And pack me a lunch. And off we go. And that's really, in the past, this was a very, very, very positive thing to have. These were the patients, the kids that could go out and work in the farms all day long and would figure out how to fix the tractor and build a new house. And yet now we are looking at this in a very negative light, and that really has to change. It just has to change, because we're losing a generation of children. And I know I'm preaching to the choir here with you guys, but I just want to make sure everybody understands what I'm saying. So I don't have to go over this slide with you guys. And I'm talking to other, I come from New Hampshire, okay, and most of the time I'm talking to very conventional, conservative people, and I have to explain to them what integrative health is, because they think it's something where I'm standing on top of Mount Washington sprinkling powders on them or something. So Mount Washington's in New Hampshire. So. And we know that actually everything is a treatment modality. Everything is a treatment modality. We have to think of life and what we do every day as a treatment modality. My dog, Omar, he's an old English bulldog. He comes to work with me, and he's a treatment modality. The kids love him. They call him Dr. Omar. He helps these kids get through things all the time. So we have to do this. In conventional medicine, I always put this at the top when I'm talking to everybody. But we can't ignore conventional medicine, even for attention deficit. Am I getting feedback? No. Okay, great. Sorry, I'm hearing it, so maybe it's just ringing in my ears. The conventional medicine is actually very important, and it is very important when we're talking about attention deficit disorder or autism. Autism, it's a little harder because we don't really have any treatments for autism conventionally except for ABA therapy. But we do know that there are kids whose lives can be changed by medication. So I don't want to just throw that away, and I'll talk about that at the end. The problem with medications with ADD is, one, they tend to work short-term. They're not long-term solutions. And the data on this is getting pretty clear, that they work and they can help people with kids in the short term, but they can't necessarily help them in the long term. I had a little girl one time that had ADD, and she's 5 years old, and I went in my first visit with her. I walked through the door, And here is my exam table, and there's 2 chairs stacked on top of it, and the kid is naked, completely naked, on top of the second chair, pushing herself through the drop ceiling, and her mom's got her by the feet trying to pull her back into the room, okay? And I'm not making this up, this is a real story, and I'll tell you when I'm lying, and so, and when I am making things up. But I said, you know, and she's like, we're not using any medications on this kid. And I'm like, I'm sorry, there's just not enough fish oil in the whole state of New Hampshire to get this kid to be in a better place. Yes, there are things we're going to do to help her long term and to really change her life. But we can't ignore medications in some of the things that we do. And I've already talked on some of this. The world has been changed by ADHD and autism. Have you guys ever read the Lightning Thief, the Percy Jackson series? In the book, everybody in the book, all the kids have ADD. I don't know if you've read that or not. They all have attention deficit disorder. And it's interesting because, at least from what I've heard, the guy who wrote the books, he's a bit of a historian, and his child has severe ADD. And he went back in history and looked at all the things that have happened from all the great people that probably had ADD and said, wow, they changed the world. And so he has these kids with this superpower, basically, which is really what they have, that it's just a different look at it versus, you know, having some kind of a bad thing. And I talked about the ADD OCD spectrum. This is a really, really, really important concept because the ADD brain and the OCD brain don't necessarily get along that well, all right? You have a 40-year-old teacher in school who's got the OCD brain because most teachers are more OCD. They like organization and structure and lesson plans. And you have the 7-year-old ADD kid. How are they going to do together? Not very well. They don't do very well. And this conflict can be a major problem. And as the world has become more OCD, then we've started looking at things and saying, oh, ADD is worse. You know, we went from just going out and playing to having to be in structures all the time. And it doesn't fit the ADD brain. The people who, you know, say, okay, we're going to put the kids in, you know, my son who has ADD, they said, we're going to put him in high school and have him do a 75-minute class. And he's going to take math his freshman year, semester beginning, and then again at the end of his sophomore year. And I said, he can't remember what he had for breakfast. How is he supposed to remember any of this? Whoever thought of that conceptually had an idea, but it doesn't work for the kids that have the ADD type brain. And again, whenever we're dealing with ADD or autism, it's not necessarily about the condition itself, but a lot of it, I'm in trouble already.
That's the feedback.
Oh, is that the feedback?
Yeah.
Got it, okay. Are you guys hearing it too, or is it just me?
On that one.
Great, and I'll stand here and now you can really hear it. That's great if I wasn't loud enough. It's not clearly towards just the disease. We have to look at all the associated issues that go along with this. I mean, if you look at kids with attention deficit disorder, there's about 80% of those that have associated anxiety too. Many of you probably know this. Anxiety and ADD go very, very closely linked. And sleep is a huge problem for a lot of the kids. That's better. See, I told you there was going to be feedback. You told me there wasn't. I'm ruining your filming. So it's not. A lot of these children struggle with sleep, a lot of issues with sleep and anxiety. And as one of my residents once said to me, Matt, when we're doing this isn't about alternative therapies or complementary therapies. This is just good medicine in terms of how you look at food and exercise and stress reduction and herbs and supplements and mind-body therapies and how you incorporate all that into this. So you guys know the data. About 10 to 20% of all school-age children have been diagnosed with attention deficit disorder. And this is how many are being treated. This isn't just how many have been diagnosed. This is how many kids are actually getting therapies for this. The common treatments now, stimulants, non-stimulants, antidepressants, clonidine or Intuitive, or clonidine and guanfacine, Intuitive, old blood pressure medicines that we use. I don't know if you guys use any of these. These are commonly used in the younger kids that are used to sedate them. We didn't use them as blood pressure meds as a nephrologist because people got too sedated from them. So instead we give them to children so that they can fall asleep. It's sort of weird. But there's an extensive amount of history using these things, and we do know that there is some effectiveness to them. But if you go back, in 1970, there was about 150,000 kids that were treated for ADD. In 2012, and this is the most recent data I could actually find, it was over 4 million kids. So what happened? What happened in 30 to 40 years? How did we get to this place? How do we get to where all these kids are being diagnosed with attention deficit disorder? The side effects are very bothersome. You see here, they say over 10% of the kids have some side effects. I would put it higher than that, and I have a bit of a skewed population. But whether it's sleep, whether it's agitation, one of the things that you'll see is when you, and for those of you guys who deal with a lot of ADD, because anxiety and ADD are closely linked, when you suppress the ADD, emotionally these kids go off the wall. And some of you may have seen this. They put the kid on Adderall and he won't leave the room and he can't stop crying. Well, I think that part of it is that we're constantly in balance between our different emotional states. And if you suppress one part that maybe is covering another part, you can see one of the other parts get worse. And so you very often hear people say, they took it, but emotionally they were wrecked. We had to just stop the medicine. I think that they probably didn't treat their anxiety. So they treated the ADD, they didn't treat the anxiety. The kid covers their anxiety by their ADD, and what's going to happen? Well, they can't function. So we have to look at the whole thing that we are when we're taking care of the kids. Having said that, parents are very worried about addictive properties and long-term side effects. And we say we have a lot of experience with these drugs, and we do. Okay, we have decades of experience with them. But do we really know the outcome? And the one thing I will say, and this is an important component, is they talk about the addictive property of the drugs and whether or not the kids can become addicted to the drugs. I think that the reality to it is that the medication, and the studies are starting to really pan out with this, if the child is really struggling with ADD, the medications can lower their long-term addictive issues. And the reason I say that is they don't self-medicate as much. And they've shown this in that if kids are treated appropriately and managed well, then you can sometimes get the parents to say, listen, it is okay short-term. I only use medications as a bridge. I always view it as a 3 to 6 month window to try and get the child to be in a better place. If the kid can't change the brain, okay? So if you're standing there and the kid, our brain works out of hubs, and the kid is constantly seeing out of this ADHD hub the whole time, and you're telling them you need to eat different, you need to exercise different, you need to control yourself different, you're saying it over and over and over again, but it's not changing. Well, sometimes you need something to kickstart it. You need something where the kid goes, oh, I get it now. My brother, who has severe ADD, okay, he described it as an afro, where his hair was just out like this all the time. And he could not get his thoughts together. He couldn't get anything to go. And when he finally got treatment, it was like somebody pulled it all together and he was in a better place. But as he says, these only work temporarily, and we have to really look at long-term therapies. So we know that in integrative care, they say 12 or 15 to 65% of kids with ADD are looking for you guys. They're looking for something besides just straightforward medication. It turns out it's probably even higher than that. It's probably well over 50% of the patients are using some form of complementary alternative therapies. The most common things are nutritional modifications. And the parents felt like they had more control. This was one of the important concepts of this. Is parents felt like when they were using these, they had more control over what was going on versus just giving somebody a medication. Interestingly, over 70% of the parents don't tell their Western medical providers about this because they're afraid they're going to be alienated, that they're going to say, well, this is, that doesn't work, there's no data, all the things that you guys have heard, when we know that's not true, okay? And this is a long-term condition that can impact all aspects of life, and we want to make sure that we're actually not just saying, okay, here you are, 6-year-old, take your Adderall for the next 50, 60 years and see how you do. We have to look at the long-term outcome. And the parents search this out. So who has ADHD? Well, I just started putting together a little bit of a list, all right? Some people say that, and this is way too busy to try and read, but some people say that it's about 90% of the CEOs in the country, CEOs who are the visionaries, probably have some form of ADD. They think almost all the founding fathers, Einstein, Bill Gates, Walt Disney. Walt Disney was supposedly the poster child. Look at all the CEOs on here, and athletes, lots of very famous athletes, and a lot of people who are, Teddy Roosevelt is one of my favorite things. If you've ever seen Ken Burns' The Roosevelts, I don't know if you guys ever watched it or not. The first half hour, just watch the first half hour if you take care of patients with ADD. Teddy Roosevelt had the single worst ADHD. He could not stand still. He just kept going. Matter of fact, when he was on the campaign trail, he literally shadowboxed up and down the train the whole time because he couldn't settle his brain down. He had 7 people that were hired full-time that rotated with him so he could just keep dictating letters over and over and over and over again. And he became one of the most important presidents in the United States, one of the most important people in the world. And I always say to people, if you're supposed to be the next Bill Gates, do we want to get rid of this? Seriously, why don't we try? I always talk about honing the ADD. Let's hone the condition. Let's improve who we are, not try and get rid of things. Teddy Roosevelt's, I like Teddy Roosevelt. He was considered to be one of the first Western martial artists. I don't know if you knew that either. He went down in the early 1900s, and the Japanese were over visited, and the Japanese guards were practicing jiu-jitsu, and he thought he was a great boxer. So he said, I'm going to take these guys on, and they tossed them all over the place, and he said, okay, teach me. So he was considered to be one of the first martial artists. Cromwell, Mozart, Lodbar, Saul, the first king of Israel, when they look historically, the Apostle Peter, they thought probably had attention deficit disorder. And it was originally here in the United States, the person that really put a lot of the name to it is a guy named George Still, and some of you may know this. In the 1900s, he actually sort of described it. But believe it or not, in 1775, some of the doctors here, the early physicians in the United States, actually started calling things attention deficit disorder, including Benjamin Rush. So this has been around a long time. It's a very heterogeneous condition. Don't worry about this. This is just, we talk about how hard it is to study this, to try and do trials, particularly from an integrative standpoint, to look at single variables and see what happens when we know we don't live in a single variable. So what do we do? So nutrition. All right, here's one of the hardest parts, and for those of you guys who take care of kids, you know what I mean. The standard American diet, or SAD, as we call it, is a disaster for kids with attention deficit disorder. And part of the reason people think that this is why we've seen such a boom in attention deficit issues. So people talk a lot about, well, what do the kids eat? And if most of you guys know, kids wake up in the morning, and I know you try and not get your patients to do this, a Pop-Tart, a bagel, maybe nothing for breakfast, a piece of pizza or a hot dog for lunch, and then maybe they'll get something more balanced at dinner time, and they eat chips and what have you. As I said to my son, I can't overcome 12 hours of Call of Duty, plus 4 bags of chips and 3 Gatorades with any kind of medication, okay? The food that we eat, we know is important. The hardest part to this is trying to really show specifically what the foods are that we need to do. And there's been multiple trials looking at different things. And I tell everybody, the first thing we have to do is just getting kids to eat well, all right? And for it's the hardest, one of the hardest things parents deal with is how do they get their kids to eat the right foods? And there's 3 or 4 different things that can be done. And you guys always, I know there's a lot of elimination diets that are done. So for example, Dr. Feingold, and some of you guys may have seen some of this. Have anybody heard of the Feingold diet from the 70s? Dr. Feingold went and he said, let's eliminate additives and let's eliminate things with naturally occurring salicylates. And he said about 50 to 70% of these kids improved with their attention issues. The problem with this is when they tried to repeat the data, they couldn't get it to be repeated. And I think it was the hardest part to this is if you look at things that have salicylates in them, actually a lot of them are really good for you. At least we think of them as being really good for us. So he was saying we need to get rid of a lot of the high and very high, or even the moderate amounts of salicylates, or be on the moderate to low. And some of the things, these are things that we actually tell people they should be eating. And so you're now taking kids who probably already are having a hard time eating the right foods, and then you're taking away some of the ones that you would want them to eat. So I have not used the Feingold diet a lot, although this one I'm asked about this one a lot, so I throw it up here. Multiple studies have looked at ADHD behavior and nutritional additives. Matter of fact, in Europe right now, they have a thing that for products that have yellow dye 5, red 5, 40, and some of the other dyes, they may have an adverse effect on activity and attention in children. They actually believe that strongly, that these dyes have, that they're actually, just like we have labels on our cigarettes and stuff, they're actually putting this on some of the foods that now have these dyes in them. We haven't done that in the United States that I know of, but that's pretty striking. There's conflicting evidence on it, but I think more and more we're saying, yeah, this looks like it does have an impact. Sugar is the other one that we talk a lot about. Our current diet is so high in terms of the glycemic load. The starches that we eat are absorbed incredibly quickly, and it just shoots the blood sugars up. And if you watch kids' activities, and they actually studied this in San Francisco, looking at blood sugars and tracking it with attention deficit disorder, they showed a clear link to some of these things. The behaviors of the kids related to the glycemic load. Having said that, they've also had studies, and these were in the 90s, they showed no difference in children with sugar, and also one where they told the parents they were giving the kids sugar and said, let's see what you think of their behaviors. And the parents said, oh, they're terrible now, and there wasn't actually any sugar in the food. So they sort of fooled the parents. But I think almost everybody has an agreement that there's certain things that we have to be careful with attention deficit disorder. One is we have to look at processed foods, we have to look at the preservatives, and we have to look at the dyes. I think there's no question on that. Sorry, I'm going to come back to this one again. The thing that I look at a lot And this is going to sound so simple, and I gave a talk to the CF Foundation up at Dartmouth on healthy foods for cystic fibrosis patients, and the name of the talk was, "What the heck do I eat?" Okay, I didn't know that Dr. Hyman had done a whole book called the same thing, but and then I said, I'm a Ukrainian grandmother, because my grandmother was from the Ukraine, and at first, calories were the most important things when they were there. When she came to the United States, she grew all of her own food, and she grew all these healthy foods because she intuitively knew that these were important. So I looking at food in a very holistic way, and in particular looking at the anti-inflammatory or the Mediterranean type diets. These tend to be the ones that have the most information out there that show improvements in almost all the emotional behavioral issues that we see. And this includes anxiety and depression. And the simple concepts is getting in as many phytonutrients as you can, lowering the glycemic load, and making the fats be the best ones that you can. I know I'm preaching to the choir on this one. I'm not even going to get too much into it. You guys already know a lot of this. Many of you probably use gluten-free, dairy-free. It's a common one that's been used, and we've seen about 30% improvement in kids with ADHD, and I like the use of that one. Many of you may be using sort of food sensitivity testing to make the decisions, but the hardest part to this is very often the kids just aren't eating good foods to start with. And the parents will say to me, well, should we get organic? And I said, well, yeah, but if you get organic lettuce, it's going to rot just as fast as non-organic lettuce if the kid's not eating it, all right? So here's what I tell, if you want to make one change in your practice, and again, I know I'm preaching to the choir on this, but I say to the kids, do you think food is important in your health? Just ask them the question, and do you think food is important in your health? And they look at me like I've got 14 heads, like, and some of them actually say, a duh, like that to me. And I say, great. So what foods do you think you should be eating to get your ADD better, get your health better? And they all say the same thing, fruits and vegetables. They all say it. And then they look and they just told me they eat 0 a day. And it's like this motivational interviewing technique. And across the board, this changes their diet. And the second thing I tell them is, don't make dramatic changes in the beginning. Do one thing. And that is, every time you get ready to eat, no matter where you are, home, school, McDonald's, wherever it happens to be, look at all the food that's in front of you. Pick the food that you think is the healthiest one, that's going to make your ADD the best, and start with that. And then you can start eating other things. But always start with the healthiest food. It gets them eating more fruits and vegetables, it helps them lower their starch content by changing the fiber content, and they now have control over something that they have not felt like they've had control over for a long time. And it's a huge component. So you can look at your elimination diets, you can look at all the other things, but really when you're talking about kids with ADD or the autism kids that are really grappling with food intake as a whole anyhow, that's the simplest and most effective way that I've seen. I don't have a problem if people want to use gluten-free, dairy-free. Again, I'm trying to present as much as we can of the data that's out there, and there has been some that's shown some benefit, but most importantly is ramping up the phytonutrients. No question on that in my mind. Pesticides, this has been another big discussion. They looked at, in 2010, they looked at over 1,000 kids who had ADD, and then 8 to 15 years of age, they had higher urinary organophosphate metabolites, they had a higher likelihood of having attention deficit disorder. A Norwegian study, again, over 1,000 kids, they said higher rates of ADD with life exposures to 4 different pesticides, the common ones that were out there. Yet, interestingly, they also looked at something where they had no increased rates of ADD or autism with higher organopesticides with moms who were getting exposed to it, which was a little surprising to me, because I thought they would have seen more changes with that. But ultimately, the reality to it is there's enough information out there with pesticides to say, yeah, we should be trying to avoid them. I mean, come on. I know, my mom says I have a keen sense of the obvious. I mean, it just sort of is obvious. But I think one of the things that, even though you might not be able to prove it in some rounds, there's enough data out there that says that it's important to do. But before people go out and spend the extra money, they need to get the kids eating the foods that they should be eating in the first place. Okay? So, what do we do for supplements? This is what everybody comes to me for. They say, Matt, we don't want the kid on Adderall, give us something else. We want the kid on Strattera, what else can the kid take? Well, there's actually quite a bit of information out there. Some of it is conflicting, but I always look at the preponderance of the evidence, and I think most of us that do integrative care, that's what we're looking for. If you try and break everything down into reduction theory, it doesn't work. So we say, let's look at this and let's look at the whole and see what we find. We know the omega-3 fats are very important in development and brain function. We also know that they're very anti-inflammatory. As you guys know, I call them nature's Motrin. If you look at the metabolism pattern for this, they actually act very similar to the non-steroidals in terms of decreasing inflammation in the body. And we know that DHA, in particular for the brain, is very important. The evidence towards low essential fatty acids is actually quite high. We see that when they've done studies on children who have ADHD, they have low omega-3 fats in their blood when they do red cell analysis. It's actually interesting because I think probably over the next 20 years, unless people change what they're doing, everybody's going to have low omega-3 fats because it's a natural deficiency that we have. And Dr. Weil talks about it as the second biggest deficiency that we have in the United States. And it appears that it may help, if you look at all the evidence, with these behavioral issues. So what I did is I took a bunch of studies. These aren't all the studies. If you guys look these up, there's dozens of studies now looking at the use of omega-3 fats in ADD. And there's at least 15 to 20 that are actually pretty good. And there's a smattering of the studies here, but these are all the positive ones. So you can have the slides or whatever. I don't know what they're doing for this. You can look at all the studies. But here are all the ones that showed some trend to benefit. This is one of the more recent ones here. In summary, there's evidence that polyunsaturated fat supplementation and monotherapy improves clinical symptoms and cognitive performance in children and adolescents with ADHD. So, the reality to it is the data out there is getting stronger about the use of these omega-3 fats. There's a handful that are negative. Now, if you go back and you actually look at the negative studies, the reason that they don't show necessarily any benefit most often is they don't use very much omega-3s. The dose of the omega-3 is usually less than 1,000 milligrams. So they do 300, 400, 500 type of thing. And most of the studies that have shown benefit have actually been up well over 1,000 milligrams. As a matter of fact, there was 2 studies where they used over 16,000 milligrams, 16 grams. I can't believe the kids took it, first of all right? And I can't believe they didn't have like the oilest diarrhea in the history of diarrhea. But they did. And the reason they did it was they wanted to show a direct correlation between the omega-3 level in the blood and the change in their behavioral. And they were able to show that. Small studies, these were only 10, 20 kids, but there was definitely enough information there. The botanical medicine, this is one of the other ones that people really get into. Because everybody's reading stuff on the internet, right? This is the bane of my existence. I get all these things off the internet. Oh, they said to take this, they said to take that. I can't tell you how many calls we get every day because somebody read something. Or the hairdresser. The hairdresser's the other one. The hairdresser gives out more information on botanicals and supplements, and they never listen to me. I'll say to them, you should take this. And they say, okay. And then they come back and say, well, we got this because the hairdresser said to get it. And I'm like, really? That's like 5 times the cost of the one I recommended. And I don't know that it's ever been shown to be helpful. But anyhow, they don't listen to me. And I guess maybe I should start cutting hair. And then they'd actually listen to me. So, ginkgo and ginseng. This is actually an interesting one. As most of you know, ginkgo's been used for a long time for brain health, memory health, and they actually combine both of these, and they're not terrible dosing amounts. 50 milligrams of ginkgo with 200 milligrams of ginseng, and they split them up. They had 36 kids in this, and they showed that actually somewhere between 30 and 70% improvement in the clinical picture with these kids. And there was very little in the way of side effects. The hard part to this was there was no placebo, there was no control group, so it's hard to know, but people did find that it was helpful. A little while later, this study came out, which is a double-blind randomized controlled trial with about 66 kids. They gave half of them ginkgo, they gave half placebo, and they actually showed that at 6 weeks there was statistical improvement in the treatment group for their attention issues. So there is some data out there. This did not have ginseng in it. The concept with the ginseng is using it as an adaptogen to sort of help with some of the hyperactivity. But the ginkgo does seem to be helpful and actually seems to be very, very well tolerated. L-carnitine. This is one I don't use that much of, actually, and I don't know why I don't, actually. But it's important in fatty acid metabolism, and its mechanism in ADHD was not 100% clear. Having said that, when they gave this to, again, these are small trials, these are 20, 30 kids. They gave it to 24 boys, 50% responded and improved on their Connor scores. And in another one, they had 112 kids that they, again, treated. And this is a study that sort of made me not be quite as aggressive with it. And they said that there was significant improvement in one group, and that was the ones that were predominantly inattentive but not hyperactive. So they found that this was somewhat helpful, but it was only helpful in a subset of the kids and not in all the kids with ADHD. Pycnogenol, Pycnogenol is used as an antioxidant. It's also been shown to be important in the dopamine and norepinephrine pathway. This had 61 children, randomized placebo-controlled trial. They saw almost no side effects, and they saw statistical improvement in these kids with their ADE. And then 1 in 24 for adults. So those of you who feel like I should be taking some, so this is actually studied in adults. And they were treated for 3 weeks. And this was interesting though, because they didn't really find a big difference between the pycnogenol and the methylphenidate group, but they also didn't see a big difference in the placebo group. So it was a little hard to know in the adults whether it was quite as effective. So now let's get to the really common ones. Zinc. How many of you guys use zinc in your ADD kids? This is probably one of the most well looked at and one of the ones that everybody talks about and parents ask about a lot. There are significant trials out there that have looked at the use of zinc. The one back in 2004 used a fairly high dose, 150 milligrams. I don't know if you guys have taken zinc. I take 20, 50 milligrams myself, and my stomach is like burning, so I have a hard time with zinc. And it's all about me, in case you guys haven't noticed. So, but they did find improvement in hyperactivity. In this one here, they used a smaller amount. They only used 15 milligrams. And they found that the patients who took the zinc alone didn't have a great improvement, but the patients that actually were on Ritalin did better and didn't need as much of their medication, which can also be very helpful. That's the Arnold one. This one here, they found that it helped. All the kids were on Ritalin. This one here, they used 15 to 30 milligrams, and they found that the zinc alone actually didn't work that well, but they helped them lower the Ritalin dose, which again, that's a win, okay? I mean, it's a real win. If these kids are on medications and you can do anything to get these drugs back a little bit, that's a real win for these kids. Valerian root, one of my more favorite herbs. How many of you guys use valerian? Love valerian. It smells awful. But this is one that's actually been looked at quite a bit in developmental peds, and this is one of the bigger ones, trials that were done. This was 900 children done in Europe, and they had what they referred to as dysomnia, which is this inability to relax and quiet themselves and fall asleep. And they found that 70 to 80% of these patients improved. There was no placebo group, but when you're looking at 900 kids and you're seeing 70 to 80% improvement, that's fairly significant. This was combined with lemon balm. So commonly valerian is combined with lemon balm and some hops. I always say 2 Bud Lights before they go to bed. The kids will be fine. But this is a great one actually for helping the kids sleep at night. The biggest problem is the smell. If you guys have ever taken it or smelled it, it stinks. And a lot of the kids, particularly my autism kids, my ADD kids, they just won't. You got to open the bottle and literally open it in another room. Sometimes the parents will come in. I don't know if this has ever happened to you. Oh, look at the new valerian we just got. And they open the bottle in my exam room, and the room's. We have to empty the room out because it smells so bad for the whole rest of the day. Iron. This is, again, how many of you use iron for ADD? This is a great one, okay? If anybody's thinking about what they should be using for this, iron is really important. When this first came out, and as I said before, I'm a pediatric nephrologist, so I tend to be a little bit skeptical. I'm not somebody who just says, yeah, let's just do this stuff. Yeah, let's just do it. I'm like, let me see what's actually out there. Let me evaluate this. This is sort of the training that I had. And we were always told, nothing really works, is what we're told in nephrology to start. But I'm like, I don't understand why iron would necessarily work. It didn't make a lot of sense to me. And then there was a trial that came out that said, okay, these kids were on Ritalin, they gave them iron, and they actually found they needed 50% of the Ritalin to do compared to the control group, which was great. And it's a 50% reduction in medication with the use of iron. And then there was 2 studies which are looking at brain MRIs, and they found that these children had low ferritin levels or low brain iron levels compared to control groups. And this was consistent. This wasn't something that was just a handful of kids. They clearly had a lower level. And then I went back and full disclosure, I never liked them with developmental pediatrics. Okay. Matter of fact, when I was either going to do ICU or nephrology, so I didn't really care if kids had ADD or autism. I was like, okay, whatever. I'm going to do some kind of intensive care work. So I did 1 day in developmental pediatrics as a pediatric resident, and then I went back later, and I got inundated with these children, and I had to say, okay, I got to learn more about this and learn more about this and learn more about this, and I reflected back to what happened back in the 80s. And do you guys remember the low iron formulas? Does everybody remember the Enfamil low iron and the Similac low iron? They actually did a study on this, and I don't know if you remember this, but they actually looked at the children 2 and 5 years out from being on low iron formulas versus the standard iron formulas. And what did they find? They found 2 basic things. One, their fetal hemoglobins natered lower during the first year of life. And 2, they had higher levels of cognitive and behavioral issues compared to the controls, the people who didn't. This was so potent that the American Academy of Pediatrics actually tried to have these removed from the market. They actually petitioned to have these formulas removed from the market. So this iron then started to make more sense to me as I started thinking about it. And what they looked at is this is a review from 2018, and there's a great review if anybody wants to look at. Yale did a great review on supplements and herbs in attention deficit disorder. You can get it online. But there's 17 studies that met criteria for looking at iron. And peripheral serum ferritin levels were significantly lower in children with ADHD. So we know that that's the case. We also know that when kids were treated with iron who had lower ferritin levels, we don't know if you have to have lower ferritin levels, but if at least the kids that did have lower ferritin levels had a significant improvement with treatment with iron. I have to tell you, I was not a believer. I was sort of like, I'm not sure I want to do this. We started sending ferritin levels off on these kids. I've had 2 kids in the hundreds of kids we've looked at with ADHD right now who've had ferritin levels that have been above 30 to 50. Everybody's on the low end. Now it's not low based on your lab, but it's low based on the therapeutic and functional number. And in particular the kids who have insomnia, because there's a huge rate of these kids with insomnia who have low ferritin levels. And you treat this and it can be dramatic. It takes about 4 weeks, but they change significantly. So I love the use of iron for these kids. B vitamins, this is one of the hardest ones. And I know this is one of the ones I get a lot of the patients coming in and saying to me, Matt, you know, we're going to take a B vitamin. Which one should we take? And we're told about, should it be methylated? Should we check the methyl tetrahydrofolate reductase? You know, what do we do with all of this? The trials on this are really hard because there's so many B vitamins and there's so many different doses and there's so many that are methylated versus non-methylated. And so you get into this big discussion as to whether you should or not. The one thing I will say, if I can say anything about this in terms of whether you should treat them with B vitamins or not, is this study, it just came out not long ago, was they had 30 brand new ADHD kids, okay? And they had 30 controls, so about 60 kids in the trial. And they looked at their pyridoxine level, folate, vitamin B12, and homocysteine levels. And almost, I think all of them actually, were lower than the control group. So the general consensus on this is that there probably is relatively low B vitamins in these kids. And so even though the studies are really hard to prove, because, you know, honestly, there's so many different things that have been done for this, that I think recommendation of B vitamins is very reasonable. I think recommendation of methylated B vitamins is very reasonable, even though it's hard to prove it in the data. Acupuncture, a traditional Chinese medicine, one of my more favorite things to use. Review in 2009 looked at 34 studies using acupuncture for these kids. And kids actually do really well with acupuncture. How many of you guys do or recommend acupuncture? Because I use a lot of acupuncture in my practice. And everybody always worried about the needles and the wires and what have you. If you have somebody who's good at shonishan or any of the non-insertion techniques, the kids do great with this. The biggest problem was there's essentially no real trials done in the United States. I've tried to find them. I've looked. I'm like, how can somebody not have really looked at ADHD and acupuncture since we have so many kids with ADHD? And in China, it's not called ADHD. They call it something different. So comparing the trials to each other are a little bit harder. But there's a lot of them out there. 34 studies that have been done, and the preponderance of the evidence is that this can be helpful. Interestingly, my adult patients who have ADHD tell me it works great. They come and they have the ear pins put in, and they say it works amazing to try and help control their ADHD. So I love the use of this if you get somebody who's is into it. And within all the community, you guys probably have tons of, I would imagine, out here in the West. It's not as many community acupuncture programs in the East Coast, but there's a lot more out here. My community acupuncture team is awesome in Manchester, and they're great with the kids. Kids are exquisitively sensitive. I don't know if you've ever used acupuncture on children. They're exquisitively sensitive to the use of acupuncture, particularly kids with neurologic issues. They seem to really do very well with this. The biggest problem in traditional Chinese medicine is that there's been a lot of reports, as you guys know, there's been a lot of reports of contamination, there's been a lot of reports of things coming from overseas that may not be good for kids that are in the actual stuff, so you have to be very careful with the supplements. Nature deficit disorder, Richard Louv wrote the book. He was actually looking at the fact that it's the lack of nature that we're actually exposing children to that is the problem. And that the more we actually expose children to nature, the better their behavior is. I know it is for me if I go stand in the woods. And if you guys ever heard of forest bathing, they do in Japan right now. They put everybody out and they tell them sit out there. They're trying to decontaminate their whole country because they've been really struggling with issues in Japan. But nature deficit disorder, well, we are too, I guess. But nature deficit disorder is a book by Dr. Louv, and there is actually a study where they put kids out and they looked at kids exercising in oops, sorry, I'm not supposed to be in front of the screen. They looked at kids exercising outside in nature, and they looked at kids exercising inside, and ADHD actually improved in the children who were outside. Electronics, the bane of the existence of ADHD. I don't know if you guys have seen these studies or not, but this is by far I think between food, the change in exercise, the OCD environment, and electronics, this is what's really making the ADD boom go crazy right now. They actually did a trial where they took kids who had ADD, they had them play electronics for an extended period of time, they retested them, and what did they find? They were worse. They actually took kids who didn't have a diagnosis of ADD, they put them on electronics for an extended period of time, and what did they find? They had ADD. This is restructuring the brain somehow. I was in San Francisco a couple months ago for the Integrative Mental Health Conference, and they're showing more and more changes occurring from these electronic exposures that are causing some of these symptoms, including some of the addiction issues that seem to be getting worse. This is really hard. Kids with ADD have a 2 to 3 times greater risk of addiction. We know they have a lot of electronic addiction and pathologic gaming. It's like taking away the crack when you try and take it away. It's really hard. And I don't know the answer to this. I would just say that whatever we need to do, we have to come up with some way to make this better. I always say, teachers get excited when they have iPads in the classroom, right? They go, oh good, everybody's got iPads. So they give out the iPads. Well, what did they just do to half the kids in the class who have some attention issues? They just ruin their day. Because these kids' brains are going, boop, 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 boop. They can't just look up. Why? And the OCD teacher goes, well, why can't they just look up American history? And the kid's trying to find the new Ford Mustang. Or get on Fortnite or whatever it happens to be. We have to realize that this is a huge component. I've had 3 kids in my practice who went off to college and who basically came back and just couldn't stop playing once their parents weren't around anymore with ADD. They just said, one of them will go to Stanford actually. Had a full scholarship to Stanford, another had a full scholarship to Worcester Polytech in Massachusetts to become video game designers. And they came back and they hadn't been to a single class, they couldn't stop. So we have to figure out what we're going to do with this, and I don't have the answer. The medications I'm not going to get into, except just to say what I said earlier. They work in the short term. If we're going to use medications, we should think of them as a bridge. The data on this is getting clearer. The longer you take them, the less they work, and the more you have to increase the dose. And then you have to just keep trying to back off or change the drug. So yes, medications work. I'm not going to say they're not helpful, but we have to think differently about how we're doing this. Because really what we want to do with this is we want to hone the ADD. If nothing else, we have to think of these kids as having their superpower and that we want to hone their attention deficit issues. All right, great. So all the things I said about ADD sort of roll it into autism. You guys have people in your practice where they come in and go, I think they're ADD, or maybe they're autistic. There's a lot of these kids that sort of come, that overlap a lot with this. We know that these numbers are going up and up. We got about 1 in 60 kids being diagnosed with autism right now. Families are searching for integrative techniques. Over 60% of these patients are looking and using some kind of integrative techniques. We know there's a lot of factors that come into play between genetics, the environment. We also know that the connection between inflammation, oxidative stress, the whole milieu that goes on in our body is actually somehow interacting with the autistic spectrum. The hardest part is that there's tons and tons of anecdotal reports in terms of what can be helpful, and yet trying to find the thing that actually works for the kids and try to find the things that works for most of the kids is really hard. My autism integrative colleagues have said the same thing. If you can find even if it's your kid's the only one that responds to it, you're like, yes, my kid responded to something, because it can be such a difficult disease for these parents. They are, and again, sometimes it's not just the autism, it's the sleep disorders. It's the kids that have autistic kids who won't sleep. They literally are up 24 hours a day, and they just keep going and going and going and going. And the parents don't get any sleep, and it's really, really difficult for them. We know nutrition is important, and we think of it similar to what we do with attention deficit disorder. Some people refer to autism as the hot brain, and that there's the inflammatory process. And so looking at an anti-inflammatory diet is really critical. The biggest thing, and I didn't even put it up here because I know almost all you guys use or have used the gluten-free, casein-free diet, the GFCF diet, one of the most common ones used. The information out there is about 30% of these kids respond to some degree or another. But some of you guys are probably looking at me and go, yeah, but they won't do it. Half the kids, all they'll eat is macaroni and cheese and you know, hot dogs or whatever, chicken nuggets, and that's all they'll eat. So how do we change that? Again, what we want to do is look at brain health, and we want to look at the anti-inflammatory foods. And if you can get the kids even a little bit bringing in the fruits and vegetables, a little bit every day, that's really the essence of how to do this. There has been looks at prenatal outcomes and whether or not exposures that families have, moms have prenatally, actually predisposes to having autism. And this interesting review, Dr. Hendren is one who's done tons and tons of work out in California on autism. But practices that have folate, omega-3, vitamin D, environmental toxin avoidance, and corrected deficiencies along with immune boosting and prolonged breastfeeding have shown less rates of autism in those children. Matter of fact, one practice looked at hundreds of moms that came through, that they removed these exposures, they did all of these things, and based on the numbers in the community, they should have had probably anywhere between 5 and 10 kids that were diagnosed with autism, and they had 0. So there does seem to be some prenatal exposures that play a role in this. So the evidence out there for what we can use from a supplement and herbal standpoint, one is melatonin. There's a lot of stuff coming out, or a lot of stuff that's been out on the use of melatonin for sleep for these children. Most people find that it helps them fall asleep, but it doesn't necessarily help with, they still wake a lot of times during the night. But there's also been at least this one study that showed these kids, their behavior seemed to improve. And it might have been that their sleep improved and so their behavior improved, but even more importantly, the caregiver quality of life improved, which was really something that was interesting when they looked at this, because so many of these parents are exhausted from taking care of these children. I mean, I have kids in my office that once they're in there, they're attacking mom, they're pulling her hair, they're all over the place in the room. I mean, you guys have probably seen it too. So getting the kids to calm a little bit, but also having it so that the caregivers have a bit of a break. And again, this study showed that the sleep duration increased, the sleep onset or latency was better, although they still had nighttime wakings. The omega-3s, I think of the omega-3s just like I do for ADD. We're trying to improve brain health. No matter what we do, we're trying to improve brain health. There's not a lot of trials in autism to show this. There's been a lot more trials in ADD. And the most recent review actually looked at 3 of these trials, and again, showed some improvement with the higher dose, showed no improvement with the lower dose, and some improvement, again, this was a lower dose, but I still recommend it as a general rule because I think it's very important for the brain health for these kids. Vitamin D, and a lot of the kids with autism also have some ADD overlap. Sorry, I know I'm going fast. I just want to make sure I get through this, and we can, if you guys have questions. And if you have questions, you can catch me after too. So, vitamin D, this was fascinating. Because the last conference I was at, there was this study that came out on vitamin D, and I don't know how it is here in Oregon. I would imagine you guys are above the vitamin D line, so there's a lot of vitamin D deficiency. I know up in New Hampshire, believe it or not, and people will think this is sacrilegious, that I don't check vitamin D levels on the kids, and I don't because they're all low, okay? I've not had a normal vitamin D level, and when you have children, you don't like to send tests off on them because they go bananas, particularly autistic kids when you're trying to check their levels. I just treat them. And this study came out in 2018, which showed significant improvement in autistic behaviors with vitamin D supplementation. And at the last conference I was at, it was like, wow, this is great. You know, we're going to really push the vitamin D. The dosages were sort of your standard 800 to 5,000 units kind of thing, depending on the kid's size. But it got retracted. The study got retracted because people looked at the numbers and said, these don't make sense. And when they asked them for the information, that people said, well, our computer died. And so they could only send them part of the information back. And so they said, we have to retract this because it doesn't look like it makes sense. So there was one prior study that showed improvement with vitamin D and autism. Having said it, it was by the same group. So I have to say I'm not 100% sure, but it doesn't really matter to me because I'm still going to recommend vitamin D. I'm sure you guys are all doing vitamin D anyhow because everybody's deficient. We know it's linked to so many conditions that I always put vitamin D for all my kids. Zinc. Zinc is actually, again, this gets into the interesting thing. We looked at it in ADD. There seemed to be some improvement with zinc in ADD. There was an article that came out, you guys might have seen it, called Zinc, the New Antidepressant. I don't know if you saw this, the article that came out, because we're looking at it not only in all these other conditions, but also depression and anxiety. And the really interesting one was in the anorexic group. There was a gentleman who had done some studies looking at improvement in anorexia through the use of zinc. But zinc levels, and in particular, low zinc-copper ratios. Now, I never send, again, I'm sacrilegious to be in a conference where people do a lot of different labs. I don't do a lot of labs. I'm a nephrologist, so you think, man, this guy must send off like every lab known to man. But I believe in one basic, there's 3 rules I believe in, okay? The first is the diagnosis and the treatment of the disease should not be worse than the disease itself. All right? Now, that may sound obvious, but it really isn't. You guys get it, but most of my Western colleagues don't get that. The second rule is that the price of liberty is eternal vigilance, all right? And that means either, as long as you stay on top of things, you can take care of them, no matter what you decide to do. And the third rule is something that an Asian philosopher once said, which is if you simply look at the single leaf of the tree, you miss the beauty of the 1,000 leaves. And we see this all the time, where we're so focused on the disease entity that we miss the bigger picture with the child and who they're supposed to become. And I'll mention that more later. But I don't do any lab tests unless I'm going to make a therapeutic change. So if I know that I'm going to treat someone with vitamin D already, I'm not going to do it. If I know that I'm going to, that zinc is well tolerated for the most part, and it's really hard to get zinc toxic even in regular doses, and I'm going to try it anyhow, I'm not going to send zinc levels off. I just haven't. But the studies have looked at this, and the zinc copper levels in autism were found to be low. 30 children treated, again, they tend to be these 20, 30 numbers. It seems to be a common thing. They improved their, a number of their cognitive and motor performances. And this was one of the things I thought was really interesting, is that they actually had a mouse model where they knocked out the way the zinc worked. I think it's called the spark mouse. Have you guys heard of this mouse before? And they used zinc in these mouse models that have autism, and they showed significant improvement in their autistic characteristics. So I think there's enough information out there, and the safety is actually quite good for this. Methyl B12, this is one that I get asked a lot about. I'm sure a lot of you guys use some IM methyl B12. You hear a lot about the methyl tetrahydrofolate reductase and whether it's bigger in kids with autism or ADD or not. Most of the trials that have looked at the MTHFR gene find that the differences are almost the same in the general population as compared to these kids with developmental issues. But you're still talking about 20-25% of the population, or 20-25% of these kids have this. So a lot of people are using methyl B12, or recommending that it be used. In the 2016 trial, they actually looked at 50 kids, and they gave IM B12. Interestingly, all their metabolic markers improved, so all the things we're looking for related to the B12 metabolism got better, but the parents saw no difference, and the clinicians said they saw improvement in the scores. So there seems to be a little bit of a discrepancy as to whether or not this is helpful. And then the 2010 study did not show a statistical significance, but they did find that there was a subset of kids that had severe behavioral issues that did do better. So this is one of those things that people use a lot of IM-B12. You'll hear people argue, can you take it orally versus not? To be honest with you, I don't know the answer. I know I'm up here supposed to tell you the answer, but I've looked at this so many times and I don't actually know the answer. I, in general, recommend a good methylated B vitamin for these children. I think it's important for them. I know that because there's a lot of crossover with the ADHD kids, and there's been a trial looking at B vitamins in kids with ADD or autism that have shown them to be low, that I do think it's reasonable to use it and treat it. Folinic acid, this is actually really interesting. Folic acid or folinic acid, there's been variable reports in kids with ADD looking at their metabolism and whether or not, autism, that was my ADD, they have problems with metabolism of folate and folinic acid. They have found that in one trial, and this was just a recent one, 48 children were treated with folinic acid, which is basically leucovorin, if you guys have used leucovorin before. We use it in chemotherapy when we're trying to stop side effects of medications. We use high-dose folinic acid. And they show that these patients had statistical significance in verbal communication. But they also found that most of these kids had what's known as folinic acid receptor alpha antibodies. So when they looked at these kids, they found these had specific antibodies to go against them. And those patients were the ones that tended to have the best improvement. Probiotics, a lot of discussion about the use of the gut-brain connection with autism. And there's been a lot of, Mass General's done a lot of work on this, looking at the use of probiotics. There's evidence that shows that it helps with, particularly since most of these kids have a lot of GI symptoms. It's a little conflicting as to whether or not it works for the autism part of it, but if you can get their belly better, it helps quite a bit. And there is now, the people are doing, you may have heard of doing fecal transplants, which to me sounds gross. But when I was doing transplant medicine, one of my nephrologists said, well, is it a living donor? One of the nephrology joke. You guys don't get it, right? Is this thing on? I'm trying my best up here. But this is actually probably the most interesting thing to me that's come out more recently. Have you guys, sulforaphane, I have a hard time saying it, but it's the broccoli extract. Have you guys seen the stuff on the sulforaphane, particularly with autism? They've done stuff out at Mass General, they've done stuff in California. There's been some good, they're not really trials, meaning there's not been a lot of placebo groups, but they've actually looked at case reports and put these kids together. And this broccoli extract has shown significant improvements in receiving this with social interaction and neurobehavioral and verbal communication in probably at least 30% of the patients. It's well tolerated, it's just really hard to find the product. There's very little of it on the market right now. This has been mostly made for the trials and not something that's been more out there on the market. But this is really well tolerated, and Dr. Hendren, again, did 15 children and showed significant improvements, and he presented this at the last conference and said this is going to be one to really keep your eyes on for the future. Great. CBD oil, we don't really have time to get into CBD, because I think we have 2 minutes. Oh, great, thanks. There we go. I'm running behind as per usual. I didn't even get the title on my great jokes and my stories, but anyway, that's what you came here for. The bottom line to CBD, you guys probably get tons of questions and a lot of CBD stuff, right? And do a lot of your autism and ADD parents ask about it? Yeah, it's really out there. The concepts are that it may be a counterbalance with THC, and it potentiates the body's own endocannabinoids, and it may impact the GABA receptors. I will say that we have seen, and this review in 2015, bless you, showed that they feel that it is helpful for a lot of anxiety, it may be helpful for sleep, it may be helpful for PTSD. We're finding it to be significantly helpful for kids with autism and ADD. I've had teachers, and this is when you know you're making a difference, because the teachers actually call. If the parents tell you one thing, it's like, yeah, okay. But when the teachers call and say to you, or to the parents, what did you do? This kid is completely different. We're seeing significant improvements in about 50% of the patients that we're using CBD oil on. I was really skeptical of this when I first, just like iron, I didn't believe that I wasn't sure about using it. And I think we still need a lot of the trials to come out, but it seems to be safe, it seems to be well tolerated, it seems to help with their sleep. And compared to the medications that a lot of these kids are put on, it's hard. You're gonna ask me how much.
What dose are you using? Okay.
I knew that was coming. The dose is unclear, okay, like everything else in the world. As little as 2.5 milligrams have worked in some of the smaller kids, but the other ones have looked at as much as 50 to even 100, 175 milligrams. So most of the kids that I'm using it on, it's somewhere between 5 to 10 milligrams twice a day. And we're not typically going over 50 milligrams total for the day. And we've seen a couple kids get tired, but other than that, it's actually been really well tolerated. And I've had some parents that, I mean, it's been dramatic. There's not the studies out there right now, but it does seem to be, I think that's going to be another big one. Now, of course, we have 1 minute left, or less than that, but here's the most important thing, okay? Every child that comes in to see you has a gift. And one of the things I say to every patient who comes in with autism, to their parents, the first thing I start to ask them about is, what is your child's gift? Because they all know what it is. It's so important. It might be music, numbers, writing. You don't know, it's hard to know what it is. But always, always, always ask this question: what is your child's gift? This is so important. Because once you know the gift, you can use that. When you find out the kid is really good at this, then you start incorporating your treatment options into what that is. If it's music, you start working with music. If it might be how they settle themselves at night. If it's numbers, some of the kids are like number geniuses, then you start bringing numbers into the play. And you start doing that so that they can work with it and they can go further. Most of the parents feel like, you know, that all they're doing is run around all day long trying to take care of their child with autism, or they're worried about the social interactions or what are going to happen. And they don't see the positiveness that can actually come out of their child that has this condition. So one of the first things you want to do is find out what the gift is. And it happens every time. You just say, so tell me, what's your child's gift? And they're going to look at you and they're going to go, oh. And they're going to say, they do this, and they're amazing at it. They're amazing at drawing. They're amazing at whatever it is. And you go, awesome. Now let's go from there. And let's work with this. I should have put this first, but I don't know, with my ADD. I'll just keep blaming my ADD, okay? I wasn't going to go to medical school. I know I'm running out of time. I'm out of time. But I wasn't going to go to medical school. I tell this story to everybody. When I didn't want to go to college, I hated school. I hated every moment of being in school, except for kindergarten. I like kindergarten, and then I didn't want to. So I tried to go in the military. My thumb got cut off, so I couldn't. So my dad made me go to college. I said, okay. I was a lacrosse player. I said, I'll try and play lacrosse. I was a forestry major, because I love being outside. I said, that's what I'll do. Well, I was working on the ambulance, and I was working on the police force, and people were falling out of windows, and we'd be there to help them and do this. And my partner on the police force said, hey, Matt, you seem to like this. You want to ride on the ambulance? And I said, sure. So I start riding on the ambulance, and I go home, and I said to my mom, hey, Mom, I think I want to go into medicine. And my mom said to me, well, don't you have to be sort of smart for that? So when I'm wrong about putting things in anything, remember my mother, okay? But everyone, you have to find out what the gift is. And then the second part of this, and we'll wrap it up with this, is remember, it's not just about the condition. You have to treat everything that's going on. And if 80% of kids with ADD have anxiety and you ignore that, you're going to lose. It's not going to work, okay? If the kid with autism also has ADHD and you're not taking care of both, you're going to lose. And sometimes it's taking care of those individual things that actually make the biggest difference for the families. And that might be doing any of the treatments that you guys usually use, whether it be manipulation or acupuncture or herbals or whatever you're using. And this is actually one of my favorite things from Lao Tzu. And it talks, I'll let you guys have it later, but there's one thing that I think is really important in our current society right now. Where's the one? Choose food. Oh, here it is. Choose your leaders for their virtue rather than their wealth or power. I think our society needs a little bit more of that right now. All right. Thank you. Just come at me. If there's something, I want everybody to go home with a deliverable. If you didn't get a deliverable, like something that you feel like you took out of this to use for your kids, then come ask me what a deliverable they can use. So, okay? All right, see you.